Hi, I'm Dr. Shim Ching, board-certified plastic surgeon. I'm based in Honolulu, Hawaii, but I also practice in Dubai and Doha. I've been doing plastic surgery for about 27 years, and I've performed about 30,000 surgeries in my career. One of my favorite procedures to perform is eyelid rejuvenation, where I can make a patient's eyes look dramatically younger. If you've been considering a lower eyelid lift, also known as a lower eyelid blepharoplasty, you're probably trying to understand the different techniques available and which one will give you the best, most natural looking results. One of the techniques I use, and I strongly recommend, is a method that combines fat transposition, pinch skin removal, and tightening of the lower eyelid. I know all this sounds complicated, but I want to explain all this to you in this video. This technique is incredibly effective for rejuvenating the lower eyelids and creating a natural, refreshed look. Today, I want to explain why this technique, in particular, is superior to other options and how it can give you the best results for long-lasting, natural eyelid rejuvenation. To start, let's break down the anatomy of the lower eyelid. The main concerns patients have in this area are puffiness due to fat bulges, excess wrinkly skin, and laxity or sagging of the eyelid tissues. With aging, the fat that naturally supports the eyelids can bulge outwards, creating those unsightly bags underneath the eyes. Additionally, the skin and muscles can weaken, causing the eyelid to droop down. One of the key components of the technique I use is fat transposition. What this does is it takes the excess fat that's causing puffiness and it repositions it into a more natural and supportive position. Instead of just removing the fat, which can leave a hollow or sunken look, fat transposition helps smooth out the lower eyelid, restore volume, which is crucial for achieving a youthful and natural appearance. Often the appearance of dark circles underneath the eyes is due to hollowness, which casts a shadow. This area is called by us plastic surgeons as the tear trough, and filling in this area by repositioning the fat pads that are already in the area is the best way to fix this hollowing. I also do this from inside the eyelid, the inner surface of the eyelid, so we don't make a traumatic incision on the outside of the eyelid. We call this a transconjunctival approach. I feel this is the safest and least traumatic way to perform that part of the surgery. This technique doesn't just remove the fat, it repositions it to restore volume to areas that may have lost support. This helps avoid the hollow aged look that some other blepharoplasty techniques give. Now, a lot of surgeons will say, I graft fat into the area instead. I prefer to transpose the fat because when I do this, the fat is still attached to your body and nourished by your own blood vessels. Whenever I move the fat into the lower eyelid, it will stay 100%. This is predictable, whereas if we graft fat, meaning we remove it from another part of your body and inject it into your lower eyelids, the variable amount of it will survive, and a possible complication could be lumps of dead fat, which can be visible and very difficult to correct. At any rate, only filling the lower eyelid with fat isn't enough, which leads us into the next component of a good lower eyelid lift. Let's talk about skin removal. Unlike older techniques that may have involved a large removal of skin from the lower eyelid, my approach uses a skin pinch removal. We only remove a small amount of skin, just enough to remove any excess, which allows the skin to naturally follow the natural contours of the lower eyelid. This technique ensures a much more natural and less pulled and tight look after the procedure. Pinch skin removal minimizes scarring, preserves the natural elasticity of the skin. You get a rejuvenated and refreshed look without the tight, unnatural appearance that can result from excessive skin removal. As your lower eyelid ages, it begins to loosen, sag, and droop, just like the rest of your face. Another part of this technique is a two-layer canthopexy, which tightens the lower eyelid, almost like having a facelift for your lower eyelids. This procedure involves tightening both the muscle layer and the lateral canthus, which is a ligament of the outer corner of the eyelid. By using these two layers, we're able to achieve a much more secure and lasting result. The lateral canthus is the anchor point of the eyelid, and tightening it prevents the lower eyelid from drooping or pulling down after surgery. By working with both the muscle and the lateral canthus, we ensure the eyelid is lifted and tightened in a way that restores its youthful, natural shape. The result is not just a cosmetic improvement, but a functional one as well, ensuring that the lower eyelid stays in place and doesn't develop complications like ectropion, where the lower eyelid pulls away from the eye. Now let's compare this to other lower eyelid techniques. Many surgeons opt for a simple skin excision or just fat removal. But these methods often fail to address the full scope of what's happening with your eye. They can leave you with hollowed out eyes or a tight, unnatural look because they don't take into account the underlying muscle and tissue that support the eyelid. The technique that I'm explaining today with fat transposition, pinch skin removal, and 2-layer canthopexy is much more comprehensive and yields much more natural and durable results. Here are some examples of patients who've undergone this technique, showing the difference in both appearance and long-term results. You can see that the eyelids look natural, refreshed, without that operated on appearance. Skin is tight but not overly stretched, and the lower eyelid is beautifully supported with no sagging or pulling. If you're considering lower eyelid blepharoplasty, I highly recommend the fat transposition, pinch skin removal, and 2-layer canthopexy approach for the most natural and lasting results. It addresses the root causes of aging around the eyes while preserving a youthful and fresh look. It's a technique that I found to be most effective for my patients, and it's the one that I trust for the best outcomes. Thank you so much for watching today's video. I hope this helps you understand why I prefer this technique for lower eyelid surgery and why it's so effective for achieving a natural and youthful result. If you have any questions or would like to learn more, please feel free to reach out to our team or schedule a consultation with us. We're here to help you look and feel your best. Please like this video, give us a comment, and subscribe to this channel where we talk about all sorts of plastic surgery topics just like this.